I've been the senior psychologist in the FNQ, ACAT and memory clinic for the last 11 years, and more recently I've diversified into some consolidated advanced care planning for patients within the Cairns Hospital and Health Service. My clinical role is supporting people who have been diagnosed with dementia and supporting the people who support them. So I support people to understand the condition that they have and to get on with the business of living. The research grant that I have received is to enable me to take some time away from my clinical role to concentrate on interviewing health professionals. I want to understand what are the factors associated with doctors feeling able to adhere to people's advanced care plans. An advanced care plan is a document which a person completes in which they can talk about what their health priorities are for the future. So they can provide consent or perhaps refusal for particular healthcare measures down the track. So if a person should come into hospital really unwell and unable to make a decision in the moment, then an advanced care plan can help enormously to understand what that person wanted. From a clinical point of view, certainly health directives can talk about whether a person does or does not want particular life-sustaining measures, but it can also talk about what things in healthcare are important to a person. What are the conditions that the person is perhaps living with? What aspects of their healthcare do they want to see preserved or perhaps limited? It depends what the person is living with and what their preferences are. The grant is going to enable me to buy some time. So I will take some time off from my clinical role and then concentrate on interviewing clinicians. At the moment I'm interviewing doctors and also some allied health and nurses to understand the lived experience when a person comes into hospital with a neurodegenerative disorder. So that could be dementia or MS, Huntington's, one of those conditions. And if the person is unable to give informed consent at that time, I want to understand what are the requirements, what's the experience of the health professionals who now have a patient who's really unwell, and they have a plan as well that was documented at some point prior. So the fund will allow me to concentrate on really interviewing and dissecting and understanding, analysing that data so that I can support decision making of our patients. Doctors ultimately are really, really important when it comes to the decision making for this vulnerable group in particular. So early days in knowing what that's going to mean, but I think our doctors come to work every day absolutely wanting to make the best decision for our patients. And so what is it about healthcare plans which might help them to make those decisions in partnering with our patients? Or what are the aspects of advanced care plans that perhaps are unhelpful? If I can understand what is helpful and what is unhelpful from the medical officer's point of view, then I can do something about it. My assumption is there will be room for a lot of education on the other side of this. So that might be educating members of the community who choose to complete an advanced care plan. I would hope to be able to advise them about the type of information which is required by doctors, and also potentially to educate health professionals as well about the expectations of the consumer group. I mean, look, ultimately legislation change potentially, because if there is a problem with the document, then I'll be arguing that too. Because I cannot know that there's a problem and not do something about it. People have got a human right to complete a plan if they wish to complete a plan. But I would also like to know that the plan is meeting the requirements of the health professionals as well. If it's not, then what is it that they need, and how do we go about marrying the needs of the health professionals and the consumers? In my role as a psychologist in the memory clinic, one of the things I've always supported people to do is to complete an advanced care plan, which often people feel good about. They often like the notion that they have the opportunity to document their wishes so that the document will continue to represent them perhaps when they don't have the capacity anymore owing to cognitive decline. So people typically feel better having done it, and they have assumptions that that's going to be followed. I saw it as a daughter supporting my father. I saw some of the complexity for the clinicians. So when I came back to work after my father's death, and I was being contacted by family members, I thought we actually have the potential sometimes for some problems. And that's problems for the person who might have completed the plan. It can be problems for the family members who are advocating, and it can certainly be problems for the health professionals as well. And so I need to understand, what are the issues? And so that's what this study is going to find out. What are the issues? If we can name it, we can tame it. To my knowledge, I'm the first person to have a look at this. I think doctors have been largely neglected in the research. Certainly in qualitative research. There's been a lot of work done on the doctor's understanding of the legislation, but I don't want to just know that there's a problem. I want to understand, why is there a problem? So I think Queensland law is quite complex, and so doctors often do have some issues with the complexity of the law. But I want to know what's upstream of that and what are all of the factors. I don't think this is just about the law. I think this is going to be multifactorial. My absolute sincere thanks and gratitude to the brothers, the Kamslers, I understand, who have donated very, very generously. I cannot thank them enough. This means the world to me. This will actually provide me with a significant amount of time to concentrate on my research. If I could thank very much the people who have participated to date and those people who are volunteering to participate in future. I am interviewing people from the community who have chosen to complete an advanced care plan, so I am still recruiting people with a neurodegenerative disorder, something perhaps MS or Huntington's disease, something like that. I would really like to hear from consumers about what they anticipate from their directive, or perhaps families who have seen somebody had completed the directive, they came into hospital, how did things go? I'm happy to speak to family members as well, allied health nurses, doctors, to hear their lived experience.